I'm Dr. Lawrence Webb, and I practice in Macon, Georgia, at the Mercer University School of Medicine and Navicent Health Center. Here recently I've had a case of a woman 50 years old who was involved in a motor vehicle accident. And she was trapped in her car that had flipped over, and it took a long time to extricate her from the car. So her orthopedic injuries consisted of an open fracture of the distal femur on the right side and a concomitant, same side that is, fracture of the tibial plateau. The opposite side had a fracture of the femoral shaft, which was segmental, and both of these represented high velocity injuries. So on day one, we stabilized the femur with a retrograde intramedullary nail on the left side. On the right side, we did a excisional debridement of the wound at the level of the distal thigh, and then spanned the injury, both the plateau as well as the femoral fracture, with an external fixator, which was anchored by pins above and below the injury, 2 in the lower part of the tibia and 2 in the upper part of the femur. Then on day 3, we went back to the operating room, took the external fixation off, redebrided the wound, and at that time we went about the business of stabilizing the fracture, which consisted of plating the fracture with a locking plate, where the locking occurred down low at the level of the condyles and standard screws up above that. We also addressed the tibial plateau with an open reduction and internal fixation. And at that time, we also placed cancellous allograft on the medial side of the condyles primarily, but entirely around it, as well as STIMULAN and some demineralized bone matrix. The STIMULAN works as an osteoconductor, and it was used for the purpose of supplementing the bone graft. The case went well. The wound went forward and healed uneventfully. And at 4 months, we had x-rays which demonstrated a bony healing. Clinically, this was also the case. So at that point, the patient was weight-bearing and mobilizing appropriately. So this patient had excellent knee motion and was fully weight-bearing and normal gait at 1 year.